It can start as a change in your skin. You might notice a new growth or a lesion or a change in a color or the texture of a mole.
For too many people, it becomes skin cancer. This morning, we welcome Dr. Dan Ness and Dr. Bill Fangman with Piedmont Plastic Surgery and Dermatology. Good morning to both of you. Thank you so much for being here.
Thank you.
Dr. Ness, skin cancer seems to be so common. How prevalent is it?
It's extremely common. There are roughly 1 in 5 Americans will develop skin cancer in their lifetime.
1 in 5?
Yes. Basal cell skin cancer alone has about 2.5 million new cases a year.
Now, Dr. Ness, why do you think so many patients choose Piedmont Plastic Surgery and Dermatology for their skin care?
Well, part of it's in the name. We have this combination of services. We've got general dermatologists, Mohs providers, and plastic surgeons, so we can treat the whole realm of disease from diagnosis to management, and there's quite a lot of coordination of care. We're trying to get the best outcomes we can in an outpatient setting.
You have a team of specialists, and it really is an approach like that. Dr. Fangman, what should people be looking for on their skin? I mean, how do we know if it looks suspect and we need to be seen?
Right. Well, we always tell people keep an eye out for anything new, especially if it's irregular or growing rapidly. And then your existing skin lesions, if they start changing, especially if you start developing symptoms, pain, bleeding. We actually brought a few pictures this morning. So this picture here, you got picture number 1 and picture number 2. It's hard to describe to patients because both of these are brown, they're irregular, they're changing. One's benign, one's cancer. You guys want to take a guess at which one's good, which one's bad?
I think the bad one is on the right.
I think the bad one is number 1.
So number 1 is completely benign. It's called a seborrheic keratosis. We see it all the time in people. Number 2 is a melanoma. So the point is it's hard to describe to patients. It's also, you can't get on the internet and just look at pictures. You know, this is one thing there isn't an app on the iPhone for. You really need to come in for a good skin exam. The next picture we have, if they show it, that on the left, picture number 1 is how most of our skin cancers start. It's a sore that just never heals up. It's very small. And so patients will delay coming in for that. On the right, there's actually bumps, and it looks more significant, but that's just enlarged oil glands.
So should we come in if it looks like it looks on the left? I mean, I wouldn't think to.
Exactly. So as soon as you can. And, you know, even some dermatologists have troubles telling good from bad, and that's why we have skin biopsies.
Okay, so you discover the abnormal lesion. What does that skin biopsy feel like? What's that process like?
It's very simple, and I can say as a person that doesn't like needles, even I could do it. It's a simple process. You're in the office for an examination, and we take a very small sample of skin, put a Band-Aid on, short, quick.
It's not a big deal. Right. Dr. Ness, what happens next, though, if a patient finds out that they do indeed have skin cancer? What's next in the process?
Then we enter the planning phase, and Dr. Fangman and I correlate our care very often. And typically in certain parts of the body, you'll simply just excise or remove the lesion, but in the more complicated cases, particularly on the face, that's where Dr. Fangman will bring his Mohs expertise.
But Dr. Fangman, we saw the pictures. What do you think makes people avoid going to the doctor to get these things checked out?
Right. One is education. That's the reason we're here today, to tell people you've got to get a periodic skin exam. Another is fear, and it's usually of the pain. And like Dr. Ness said, it's not much more than a flu shot. It's a small needle poke. And then unfortunately, we live in a times where sometimes there's financial concerns. So you could have a copay of insurance that's keeping you from coming to see your doctor. But the point is, even melanoma, our most deadliest skin cancer, has a 98% cure rate if we get it off when it's all in the skin. It is definitely worth your copay. And obviously, we think our group is the skin cancer experts in the area. But the truth is, you've got to get checked out. So there's the health department. There's free cancer screenings around Charlotte. There's your primary care doctor. But you've got to get in and get those lesions checked.
Just go, and go once a year just to have a full body check over, don't you think?
Exactly.
That's a good idea. Piedmont Plastic Surgery and Dermatology has 6 offices in Charlotte, Gastonia, Hickory, and Shelby. You can call them at this number, get a pen and a piece of paper. It's 704-866-7576. 704-866-7576. You can also go to ppsd.com to learn more and to schedule an appointment. And for your convenience, you can fill out all of your patient forms online prior to the appointment, so it'll save you some time when you get there. You really are the pros and the experts. Thank you so much for being here today.
Thank you so much.